Good morning and welcome to the Physician Assistant Talk Show, where we answer the health questions you've been asking. Today our topic is permanent contraception.
Today we will talk about sterilization methods in both men and women. In women, there's a procedure available called tubal ligation, which ultimately blocks the eggs from coming in contact with the sperm within the fallopian tubes.
And in males, we're going to talk about a vasectomy, which severs the vas deferens and prevents the flow of sperm through the penis upon ejaculation. Both of these methods have a typical failure rate of less than 1%. While they're highly effective at preventing pregnancy, it's important to remember that neither one of them will protect against STDs. Some advantages of both the procedures are that they are highly effective at preventing pregnancy and they rarely need another surgical procedure or a change in lifestyle after the initial procedure is performed. Some disadvantages for a vasectomy specifically are the need to refrain from sexual activity for 1 week after the procedure, and then use an alternative form of contraception for 3 months after the procedure until they can follow up with their urologist and have a semen analysis performed.
Additional disadvantages for both men and women in these procedures would be the possibility of infection. Additionally, one would be concerned about bleeding, swelling, and pain following the procedure. Also, both parties must consider the possibility of post-surgical regret, as these both are permanent procedures.
So if you're wanting to get a tubal ligation, really you can get it done by any OBGYN. You just have to consider the fact that you'd be out of work for about a week and you'd have to refrain from sexual activity for about 3 weeks.
A man who's interested in having a vasectomy can go to a urologist to have the procedure done. It's really cost effective. It costs about $350 to $1,000, just depending. And when you compare that to other forms of contraception and the fact that this is a permanent solution, you really are getting more bang for your buck. Usually after a vasectomy, men can return to work in 1 day. They have to take 1 day off of work, and they can return to full physical activity after 1 week. Okay.
I think that about sums it up.
And just remember, if you have a vasectomy, you're 100% juice